Rabies. Just the name itself is pretty terrifying, right? It's a disease that's haunted us for centuries, basically a death sentence with a nearly 100% fatality rate. But what if I told you it's also a disease we can beat every single time? Let's get into it.
So let's get one thing straight right from the start. Once the symptoms of rabies actually appear, we're talking fever, confusion, that classic fear of water, the battle is, I'm afraid, already lost. At that point, there's no cure. It's just a relentless, awful progression, making it one of the absolute deadliest viruses we know of.
And here's the twist, and it's a big one. This disease that is almost certain death is also almost completely preventable. So how can something be both a guaranteed death sentence and a totally solved problem? Well, that's the bizarre paradox we're going to unravel right now. Okay, so if we're going to win this race, we have to know our opponent. What exactly is this microscopic assassin, and how does it turn the body against itself in such a devastating way? As you can see, rabies is a virus with a very specific target, the central nervous system. The command center for your entire body. And it's that last, chilling phrase that we just can't forget, almost always fatal once clinical symptoms appear.
And don't think for a second, this is some far-off, exotic disease. Rabies is a global threat, for sure, but its shadow is definitely darkest in parts of Asia and Africa, where things like access to healthcare and animal control can be, well, a huge challenge.
This chart, wow, it really puts things into perspective. A staggering 36% of all rabies deaths, that's more than a third of the world's total, happen in just one country, India. This isn't just a statistic, you guys. It's a massive public health crisis.
And this is what that percentage looks like in human terms. 20,000 lives lost every single year. 20,000 families are just shattered by a disease we absolutely have the tools to prevent. It's a tragedy on an unbelievable scale. So where's all this coming from? Well, the data is crystal clear on this one. In 99% of cases, the journey of rabies into a human body starts with one single event, a bite from a rabid dog. The virus is just waiting there in the animal's saliva, ready to jump to a new host. Now this is where the race against time really kicks off. Because after a bite, the virus doesn't just start causing problems right away. Nope. It goes on this silent, stealthy journey through the body. And that silent period, that's our window of opportunity. That's the critical time when we can stop it dead in its tracks. This slide basically lays out the racetrack for us. First, the virus gets in and sets up a little base camp in the muscle tissue, where it starts multiplying. Then, it hijacks the nervous system's highways, just racing towards the spinal cord and, the finish line, the brain. Once it crosses that line and sparks that inflammation, the race is over.
Yeah, this quote just nails it, doesn't it? Every single thing we do after potential exposure is all about one goal: stop that virus before it reaches the brain. It's a biological race against the clock, and the stakes are, literally, life and death. All right, so we've seen the problem. We totally get the urgency. Now for the good part. Let's talk about the solution. How did science hand us the ultimate weapon to win this race, every single time? This is where the science gets so cool. Scientists took the deadly wild virus and basically tamed it in a lab. They created this modified version that can't actually cause the disease, but it works like a training dummy for your immune system. It teaches your body's defenses how to recognize and destroy the real enemy before it can do any harm. It's brilliant. And that brings us to the medical miracle known as PEP. That stands for post-exposure prophylaxis. I know, it's a mouthful, but let's break it down. Post-exposure means after you've been exposed, and prophylaxis just means preventing a disease. So this isn't a vaccine you get just in case. It's a treatment you start after a bite, and if you get it quickly, it's practically guaranteed to save your life. Okay, everybody, listen up. This is probably the most important part of our entire explainer. If you or anyone you know is ever bitten by an animal, these are the 3 life-saving steps you need to take immediately. This is your survival playbook. First, and I cannot stress this enough, wash the wound. And I don't mean a quick rinse. I mean a full 15 minutes with soap and running water. This one simple act can physically wash away a ton of the virus. Second, see a doctor right away. Do not wait. Do not see how it goes. Just go. And third, if the doctor says so, vaccinate. Get the full course of shots. That's it. That simple 3-step plan is the key to that 100% prevention rate. So let's just hammer this home one more time. Every step in that playbook is designed to win the race. Washing the wound is your head start. Seeing a doctor gets you on the right track. And the vaccine, that's your secret weapon.
Every minute you save by acting fast is another minute closer to safety.
And that brings us to this final, just haunting question. We have a perfect medical solution for a perfectly deadly disease. The science is solved, so why on earth does the clock still run out for someone somewhere in the world every 9 minutes? The answer, it isn't in a lab or a hospital. It's in awareness, it's in access, and it's in education. And that is a race we all have a part to play in winning.